a year ago. We staged him up. We've got a PET CT scan. We know where the cancer is. He is treatable, and I'm happy to discuss that with the patient and the family. So a fresh second opinion, yeah, it may be worth your life too. My name is Dr. Lederman from Radiosurgery New York. We're a cancer treatment center in the heart of Manhattan. That's what we do. We treat cancer. We're a private cancer center. We work for you, not the drug companies, not the surgeons. We work for you. You're our boss. You get us. You don't get the student. You don't get the resident. You can call up. You don't get a machine. You get a doctor. And we are different, I believe, than other places. We take most insurances, Medicare, Medicaid. My name is Dr. Lederman. We're going to be back in just a moment after this word.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you with body radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212 Choices, 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid, accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212 Choices.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Call Dr. Lederman at 212 Choices, 212 Choices for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212 Choices. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212 Choices.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212 Choices for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back. By the way, I didn't mention we're live, and we have Ed and Bob who are running the studio today. In fact, they're running, I think, all of WOR today. So if you have a question or want to speak, you can call us at 800-321-0710. 1-800-321-0710. Bob or Ed will pick up and put your call through, and then we can answer your questions. We did have a call a couple minutes before the show started about, tell me about myeloma, multiple myeloma. Well, myeloma is a cancer of the bone marrow, and the bone marrow is like a factory. So a lot of us think about the bones like a big, strong piece of bone, like it'd be steel, like steel in a skyscraper. And in a way it is. Our bones give us our height, our bones give us our shape, but also inside the bone is a factory. And without that factory, we couldn't survive. That factory is working day and night. It's making our blood cells, red blood cells, white blood cells. It's making platelets. Red blood cells carry oxygen to the body and carry away other products. White cells fight infections, and platelets help stop bleeding. So the bone marrow is critical. And certain people get cancers. You've probably heard about leukemias. Well, there's also a kind of cancer called multiple myeloma or myeloma. And often patients don't know they have a cancer until something bad happens. With myeloma, because the cancers in the bone marrow can actually eat through the bones and destroy the bone, so it can cause pain, number one. And myeloma also produces proteins, and these proteins can clog up the kidneys and put a person in kidney failure. So it can be a devastating cancer. We often treat people with myeloma because of the pain. We can make that pain go away, make the cancer in the bone go away. So we are often involved in treatment for myeloma. Also, there's other systemic treatments that are used for myeloma, and many people nowadays are put into remission with myeloma. So it's a disease that's tested by the blood and by the urine, and often a bone marrow test, which puts a little needle into the bone and sucks out some cells, will confirm the diagnosis. So multiple myeloma is one of the malignancies of the bone marrow. And we also had a man call. I saw him about a month ago. He lost 50 pounds. He has cancer. He's on chemotherapy in New Jersey. He came with his brother, who seemed like a giant. His brother was, 6 feet tall. This man the patient was 180 pounds, and now he's down to 130 pounds. He came with his wife. And we worked him up, offered to stage him up to know exactly where the cancer is. And he was very reluctant, very hesitant. And so I said, look, it's whatever you want. You're the president of the United States of your body. It's not me. I'm only the advisor. I can tell you what I think. I can act like Sherlock Holmes, and some days I'm a better Sherlock Holmes than others. And finally, this week, he got that staging test. He got a PET scan. And sad to say, the cancer has grown. So we informed him as soon as we heard on Thursday. Friday he called me. Saturday he called me many times. Saturday morning he said he wants to come in, but his wife won't let him. She'll let him get chemo that's not working, but she won't let him come to get a treatment that has, I think, a better chance of controlling the cancer. Finally, by Saturday night, he called again and again and wants to come in to talk about treatment. So that's the kind of work we do, and we realize a lot of people might be skeptical and to listen to the doctor on the radio. Yeah, but I'm not only a radio doctor. I'm a real doctor and a medical degree, and I'm board certified. And if you want to come and see our facility, you're welcome to do so. We're at 1384 Broadway. We're in the heart of New York City, just a few steps from Macy's and Times Square and Penn Station and Grand Central Station and Port Authority and PATH trains. So we're easy to get to. If you want to just come in and pick up some of the booklets, we have separate booklets which are available at no charge for the brain tumors, prostate cancer, and body cancers. And we also have a DVD which we'll be happy to give to you, or if you call us, our office number is 212-CHOICES, and we'll actually send it to you at no charge. 212-CHOICES is our office number. It's best to call Monday through Friday, 9 to 5. Our staff will pick up and get your address and pop it in the mail to you. So we're not only super convenient, but I think we're super. We answer your calls. You don't have students taking care of you. You have the real doctor, answers your calls, answers your questions, and provides, hopefully, a way to solve your problem. We had a woman who came in this week from upstate. Actually, she came in last week, 67 years old. She noticed a pretty good-sized lump in her right breast. She's had it for several years. She decided finally to get it evaluated, and she came in and got it evaluated. Like I said, we can numb up the skin, put a little needle in. It takes just a moment, really. And we staged her up. So not only did she have the diagnosis made, but she knows the extent of what's going on. Well, she has a breast cancer in the right breast, and it's spread to under the armpit in the axillary lymph nodes. And it's also spread to the lymph nodes under the muscle. Now, women have pectoralis muscle just like men do. I know some men like to build them up and be in magazines like Mr. America, like Arnold Schwarzenegger. Well, women have that same muscle. That's how they move their arm, just like men move their arm. So she has cancer in 3 spots: the breast, the axilla and under the muscle, the pectoralis muscle. So we've got her staged up. We did cancer markers. We're now starting treatment for her. And the warning for all is if you've got a lump or a mass that's not going away, you may want to come in and find out what it is. We can find it out painlessly, easily, quickly. That's the kind of work we do. We're starting treatment. We wish her well and hope and are working for a complete remission. It's certainly possible in her. And we have a man who came in just this week who has a recurrent cancer. He went to one of the big hospitals in Manhattan in 1996. He's now 73. So at age 55, he's a 73-year-old black man with 2 boys. Both of the boys are deceased, so it's really sad. He worked for the city of New York. He had prostate cancer surgery at one of the big hospitals in Manhattan in 1996. And if you look at our statistics in our booklet, you will see that most men who have prostate surgery will end up impotent and incontinent. This man is not only impotent and incontinent and wearing a diaper, but his cancer's come back. So he's had the worst of all. He had the surgery hoping it was going to work. It didn't work. The cancer came back, and it's left him impotent and incontinent for the last 18 years. He came to see us. We staged him up. We know that there's data showing that radiation after radical prostatectomy will help. It doesn't help as much as doing the best treatment first. And had he had the best treatment first, we know that there's a better chance that he would be cancer-free today and have his sex life and urinary life. So for men with prostate cancer or elevation of your PSA, you may want to come in beforehand so you don't have to suffer like this man. 18 years of wearing a diaper, 18 years of impotence, 18 years of incontinence, and now recurrence of his cancer after radical surgery at one of the big hospitals. We're going to do everything we can to get him in remission and a second chance. But please, if you have a newly diagnosed prostate cancer or elevation of your PSA, let's look at the data first. And another man, 53 years old, a black man. And why I'm talking about black men? Because the mortality in the black community is double. The death rate from prostate cancer is double in the black community and the white community. So it's so critical to do the right thing. This man's 53 years old. He has a Gleason 8. He went to another hospital, worked up, and found widespread metastatic prostate cancer in most all of the bones. He was actually bleeding due to excessive use of aspirin. He had so much pain. He was overdosing on aspirin. It was eroding through his stomach. He had a biopsy which showed Gleason 8 cancer, so the cancer was very aggressive. He was placed on hormonal therapy, still with pain. He came to us to get rid of the pain. He also heard that a little shot of radiation to the breast may help a man avoid gynecomastia, which means for many men who have prostate cancer like him, who are placed on hormones, they can grow breasts because they don't have the testosterone in them. These hormones take away the testosterone. And we know that a little shot of radiation to the breast buds, just under the nipple, will help prevent gynecomastia, which can be painful, can be sore, can be embarrassing. Most men do not want to have breasts. So for this man, he came in. We hope to take care of his pain, which most likely we can do. We hope to prevent breasts from growing in him from the hormonal therapy. And again, 53 years old, we'd urge you to consider screening and the possibility of treatment. We're going to talk later in the show or the show tonight about a new randomized study that show that screening and treatment of prostate cancer can reduce mortality of prostate cancer. So my name is Dr. Lederman. We're going to take a short break to hear from our sponsor, and then we'll be right back with more news and patients.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. That's Dr. Lederman, the radiosurgery pioneer's goal, too. Dr. Lederman is first in America, first in New York, first for you with body radiosurgery. Dr. Lederman hits your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Goals are best results and quality of life. Meet